On behalf of our colleagues from the Hong Kong University, it's indeed my great pleasure to share with you our recent findings on the impact of COVID-19 pandemic on socio-emotional development of our children. We were focusing on the challenges and the opportunities our young generation are facing. This is the sunset over the South China Sea on the 20th of February, year 2020, which marked the beginning of a challenging journey when the first pediatric case of COVID-19 infection is admitted in Hong Kong. Soon afterwards, the World Health Organization declared the spread of COVID-19 as a global pandemic. And all our children and families are heavily affected with a territory-wide school closure in the early times of year 2020, involving our kindergartens, primary and secondary schools. And during the time, many of our students studying overseas were also returning to Hong Kong. While we were working very hard in the isolation ward to taking care of our children and families infected with COVID-19, everyone in the community also faced a pandemic situation with panic about the very basic materials, including the very useful face masks and antiseptic utensils. It is during the time that we formed a very timely team working together with the different departments, as well as our partners in Wuhan and other parts of Asia, to form the collaborative consortium looking at the different perspectives to improve the understanding about the emerging COVID-19 infection. It is one of the first papers we published in the Gut about gastrointestinal symptoms that can predict the outcome of the children at the very beginning. Soon afterwards, our close collaborators in Shanghai Children's Medical Center reported the first major paper in the Lancet about the potential adverse effect of home confinement on children during the COVID-19 outbreak. And after that, different partners and also different experts in different parts of the world also reported and alerted us about the potential psychosocial impact and the mental health problems that prolonged confinement and COVID-19 social distancing can add on all our children and their family members. In order to have a better understanding about the impact of COVID-19 on children, we must start about our improved knowledge about the neuroscience of our brain development. In fact, our brain is not mature at birth, and it is something that can be changed by experience, particularly talking about the early life relationship, which can have direct impact, not just on the brain function, but also can change the brain structure. Now, at the very beginning, the brain of a newborn was only around 300 grams, but it increased rapidly to around 3 times by 12 months. And then by 24 months, the brain had actively grown to around 1 kilogram. The synaptic network actually had been increased dramatically in the first years of life, which forms the biological basis on the early learning and why the adverse life environment could heavily impact on the well-being of our children in the long run. Now, this is a very useful schematic diagram demonstrating about the critical sensitive period in the early brain development. We start our learning and all the development of the critical pathways by the basic visual pathways, auditory sensory pathways, the ways of responding, and then the language and emotional control one by one. But as you can tell, most of those critical pathways in terms of sensory development were focused mainly on the first few years of life. That's why when there's any heavy adverse environment and impact in the early life, it would have a definite lifelong impact. Now we have more evidence to suggest how a child was being turned out is actually the outcome of the transaction between the biological constitution and the environment. Significant adversity in early life would have major impact on the long-term development of our children, as signified by the presence of unfavorable early life factors, including poverty, impaired mental well-being of the parents, child abuse, as well as teenage pregnancy and substance abuse behaviors among the parents. Now, it is not just the development which will be affected, but also a major depression as a reflection of different sorts of mental health disorders, as well as physical health problems like ischemic heart disease. All of them were being affected by the early life adversity. In order to have a better understanding about the biosocial background and also how a child would proceed because of the early life environment, we have conducted an early life longitudinal cohort in the kindergarten stage more than 10 years ago. This research is a longitudinal study which had identified the early profile of children, including the existence of a socioeconomic gradient in the school readiness of Chinese preschool children at the very beginning. Now, our group worked very closely with our colleagues in the education department and in a different perspective, also including our global partners, in order to better understand how the family and the school environment would affect the well-being of our children. Now, judging from our scientific path analysis, we can realize family background can affect the subsequent school readiness basically through both the family as well as the school environmental pathway. Around 1/3 of the reason could be accounted by the family level, and another 1/3 of the factors can be accounted by the school level. Now, in Hong Kong, most of our lower SES families do suffer from an unfavorable family process with infrequent quality parent-child interactions, overuse of electronic devices of the children at home, as well as lacking of insight to improve the parent-child interactions. At the same time, they also have a relative unfavorable chance to enter into a good kindergarten with a stable teaching pool and with teachers of having high quality and continuous education. That is what we call double jeopardy, and also account for why lower SES children in Hong Kong have relatively low school readiness to start with. Now, when comparing with the different factors affecting early life development, we try to assess the relativity profile in terms of the household income, parental education level, even parental occupation with the different sorts of activities, particularly focusing on parent-child interactive activities. Now, through this very special predictive model, working together with Professor James Hedman, a good mentor in the field of economy from University of Chicago, we identify actually parent-child interactive quality is one of the most reliable predictor that could predict the final outcome of a child's long-term development. Now, even a child was coming from a lower SES family, if we had good quality parent-child interaction, particularly focusing on improving the social-emotional outcome of the children, we finally would find the higher the quality of the parent-child interactions, particularly through interactive play, the higher would be the school readiness of a child in longer run. Now, that is why during the onset of the COVID-19 pandemic, we are particularly worrying about the environmental change, in particular the school confinement and then the social distancing measure, whether they may have significant impact on the vulnerability and the resilience of our children during the pandemic. Now, at the very beginning of the pandemic, just talking about a few months after the major outbreak, we conduct one of the earliest territory-wide studies over around 30,000 of families having young children in Hong Kong. We try to identify what are the major psychosocial and then the parental factors that will affect the functioning of the kids as well as the mental well-being of the whole families. Now, to our surprise, we find there's a lot of psychosocial problems being worsening because of the home confinement, and also the parents were the major group experiencing much higher stress during the pandemic. This is actually aligned with what our NGO partners like BGCA, Boys and Girls Clubs Association of Hong Kong, have found in their different population-based studies. Basically, many collaborators in the social work field also found the emotional and mental health status of parents were generally getting worse together with the children, and then most of those problems are rooted in the relatively disadvantaged families.